Hey everyone, Daniela here from the Obstacle Doc, and today we're talking about modification for exercise, specifically modification for pain with exercise. So this could be pain when you are in a group fitness class, personal training session, on a run, or maybe even doing your exercise for physical therapy. So we always want to be mindful about how we are changing an activity before we quit altogether. So the first thing that you can do when you're trying to modify an exercise is get a little bit more tactile information, tactile cueing into the muscle that's trying to work. So for example, if you're having difficulty or any kind of elbow pain with a tricep extension or elbow flexion, such as for a bicep curl, what you can do is try to maybe touch the bicep, touch the tricep, get some more stimulation into those mechanoreceptors, get a little bit into the nerdy science of telling that muscle, hey, this is what you're supposed to be doing. In yoga, we talk about drawing the mind's eye to that body so that you're really being mindful of the movement in and of itself. So sometimes getting a little bit more stimulation into the muscle is going to be helpful into decreasing the pain sensation that you're having. The second thing that we can modify is your range of motion. So if 0 to 180 degrees is the full range and you're having difficulty in this last half, you could just stick to 0 to 90 degrees. So if that's a bicep curl, right, maybe you're just going halfway. Or if maybe full extension or full flexion is difficult, you can stay in the middle zone of that range of motion. Whatever range of motion is keeping you out of the pain zone, that's where we're trying to target. So discomfort is different from pain. We always want to negotiate discomfort because discomfort is sometimes where we grow, but pain is where we want to stay away from. So that can be your second modification in your modification ladder. So the third modification that we can do is increasing or decreasing speed. Most of the time for people, if we're in a group fitness setting or if we're trying to do some programming on our own, we might be going too fast. And going too fast is where we can start to lose, again, some of that mindful movement, understanding where the motion's supposed to be coming from. So if we're really trying to jam out some reps and we're starting to get that pain sensation, maybe going a little bit slower. Again, we're drawing to that mindful movement. We're drawing to that range of motion. Where are we in space? That can be the third step into modifying your activity. The fourth step to modification can be decreasing the load. So when we talk about load, it's not necessarily just a weight. So if you're holding a 15-pound weight, changing to a 10-pound weight, sometimes if you're holding resistance bands, the level of resistance is going to give you more or less. So that is also load. Load is also gravity specific. So gravity is obviously a force that's pulling down on you. So depending on where you are in space, if you're lying on your stomach, lying on your back, side lying, standing with a bar on you, standing with weights in your hands, gravity is going to affect you in all those different kinds of positions. So if you need to be in a gravity neutral position, maybe that's side lying, maybe that's laying on your back, maybe that's laying on your stomach, depending on the exercise itself. That is a different way to decrease load. And then again, that's the fourth step in modification. The fifth and final step in our modification ladder is just changing the exercise altogether. So there are some exercises that are just not friendly for people, whether that's a choice, maybe they just don't like doing it. Maybe you don't feel the muscle the way that you're supposed to or the way that you've been told to feel it. Maybe it's just not possible for you to get into that position. So thinking of any kind of physical barriers, if you are pregnant, postpartum, any surgical scars or places of healing, any of those reasons that you either cannot or do not want to perform an exercise in the way it is given, shown, prescribed, then we'll look at a different exercise altogether. What we want to make sure is that we're still keeping an efficient movement in the muscle. So, you're not going to substitute a bicep curl for something that kind of negates the bicep altogether. You still want to keep the efficiency in that movement, but maybe just somewhere where you are more comfortable and not causing any of those pain sensations. And that is going to be your fifth and final step when we're talking about modifications for exercise.